Now, question for you. Here at HIMSS 13, there's been a lot of talk about healthcare reform. So in your opinion, as a CIO of a hospital, what does that reform look like?
Yeah, none of us are exactly sure yet, but the one thing we know is that it's going to force us to get our arms around more data than we've ever had before. So as we kind of go through the transition and payment models or what the Accountable Care Act may mean to us, we understand that we're going to have to reach all the technicals of healthcare in our community that are outside of the traditional bounds, I think, of the hospital. And so that's one of our biggest challenges, and yet that's probably the most exciting thing that we're working on right now.
Okay. Now, from a health IT perspective, Beaufort Memorial has done quite well. You've made the most connected list, and so what's next on your list for that?
That's what we're always trying to figure out, right? And we don't like to implement technology just for the sake of it. We're trying to improve processes, and so that's really what our challenge is, to find things where we can create efficiencies. And one of the things we've just finished is like a house-wide patient throughput solution. It's really helping us pull out little increments of areas that we can improve the process and make ourselves more efficient, more in preparation for what's going to happen with healthcare reform.
Okay. Now that you have all these additional projects you're working on, the ICD-10, HIPAA compliance, meaningful use, what's been the most difficult and laborious?
The most difficult is that there are so many. It is so tough. Yeah. We're not a giant organization, and so we're very, very busy, reach out to a lot of people for help for things. And I think that it's just understanding all the different regulations and trying to communicate what that means to all our clinicians. We're there to provide care, and so for the most part, they don't care about some of those things. They want to do the right thing, and we've got our challenges to tie it together, make it meaningful to them, I suppose, in that context, and then just kind of work through the processes.
Now, in 2004, President Bush established the position of ONC coordinator, and in your opinion, since then, what has been the single greatest achievement in health IT?
I think the one thing is that it's brought us so much to the forefront. Now it's not so much a back office, it really is how do we impact the clinical care and the quality of the care that we deliver, and it's kind of pushed us to all move forward. And so then coming with meaningful use, you can argue whether some of it was good or bad, but it is, I think all the intent is very good for that. And so I think just bringing it to the forefront, making us move forward as an industry and catch up, I guess, to some degree compared to some other industries.
Okay, well, thank you so much, Ed, for being with us today. We really appreciate it.